Good morning, everyone. My name is Aamir Saeed. Currently, I'm working as a GI fellow at University of Tennessee, Memphis, and I would say thank you to GIE for providing us this opportunity for the author interview for our recently published article in GIE on safety and efficacy of same-day discharge after GPOM in patients with gastroparesis, a systematic review and meta-analysis. I'm grateful to my mentors and co-authors, including Dr. Kamal, Dr. Sultan, and Dr. Alinsky, and all other co-authors. So, a little bit of background about GPOM and in patients with gastroparesis. The post-operative care after GPOM in patients with refractory gastroparesis lacks standardization. So we aim to assess and evaluated the readmission rate, emergency visits, and the procedure-related complications between the patients with same-day discharge and patients admitted overnight for observation undergoing GPOM. Generally, patients after GPOM are admitted overnight for observation with no adverse events, started on clear liquid diet, and undergo upper GI imaging to confirm there is no contrast leakage. However, recently studies came out and they recommended safety of same-day discharge after the procedure in patients with no complications, intraoperative complications, and with no comorbidities. American Gastroenterological Association Institute Clinical Practice Update recommended that patients with no major comorbidities or intraoperative complications can be discharged on same day with oral pain management. Recently, a new multi-center retrospective study was published in GIE, and they compared the safety of same-day discharge versus overnight admission after GPOM, and they recommended that the patients can be discharged, uncomplicated patients can be discharged on the same day, and the authors found out the incidence of adverse event and 15-day admission rate was lower in patients with same-day discharge. So, to conduct this meta analysis, we reviewed several databases from inception to July 2025, and our outcome of interest were readmission, emergency visits within 30 days, and the comparison of procedure related adverse events between the different groups. Data was analyzed using random effect model, so we included total 6 retrospective studies with total 738 patients, with 255 patients in same day discharge group and 483 patients in overnight admitted group. So in results, we found out there was no significant difference between the groups of same-day discharge and overnight admit patients regarding 30 days readmission rate, 30-day ED visits, or procedure-related adverse events. However, we found out the procedure time was significantly shorter in patients with same-day discharge group as compared to the patients with overnight admitted. So in conclusion, our meta-analysis demonstrate lower procedure time in the same-day discharge group, and there is no difference in readmission, ED visits, and complication rate between the same-day discharge and overnight admitted patients after GPOM and gastroparesis. Further large studies are needed to validate these results and to facilitate the development of standardized protocol for managing patients after GPOM and patients with no comorbidities and no intraoperative complications can be safely discharged on the same day after the GPOM. We really want to say thank you to GIE again for providing us this opportunity for the author interview.